Hello, welcome back. Welcome back to Pharmacology. Welcome back to multiple choice questions. That's your life and death multiple choice questions. We're beginning with a fresh session, a new session. Question number 1. Antipsychotic with less extrapyramidal side effect is loxapine, pimozide, quetiapine, chlorpromazine and haloperidol. You know, the traditional antipsychotic drugs, they are known to produce extrapyramidal symptoms. They are known to block the D2 receptors, so that leads to extrapyramidal symptoms, EPS. And the newer or the atypical antipsychotics have got the less liability to produce extrapyramidal symptoms. So I told you the gist of the question. You should solve the question yourself now. Loxapine, pimozide, quetiapine, chlorpromazine, haloperidol. Just remove loxapine, pimozide, chlorpromazine, haloperidol. I said these are all older antipsychotic agents with more liability to produce extrapyramidal effects, and we are left with quetiapine. Let's take the name of some newer antipsychotic agents just for your reminder. Clozapine, olanzapine, risperidone, quetiapine, aripiprazole, ziprasidone. Is that fine? So we are speaking about this particular group. Less liability to produce extrapyramidal side effects, and that's the great advantage of atypical antipsychotics over the traditional ones. So look at the answer, that's quetiapine. Let's go to the next question. Donepezil is used in treatment of. I think I said on one of the multiple choice question session that have a special notebook for pharmacology classifications, and prepare your classifications well. Read from the book, close the book, sing a song, try to memorize, write it on a blank sheet of paper, and then look how much you can remember. Again open the book, find out what you missed, again take a blank paper, again practice, and when you can remember, enter it in the classification notebook. This is going to be very helpful, because in the first place you need to identify from your mind this drug is from what class. I heard this drug in which system, CVS, CNS, RS, respiratory. You need to know this first. If you locate the drug is from which particular class, rest of the thing can be easy. Okay, I hope you shall do it. Let's go back to the questions. Donepezil is used in treatment of schizophrenia, depression, anxiety, Alzheimer dementia and myasthenia gravis. So we need to know what is donepezil. It is from which class? ANS, CNS, CVS. It came in ANS as well as it came in the central nervous system. Donepezil is an anticholinesterase agent. It inhibits the cholinesterase enzyme, inhibits the breakdown of acetylcholine and concentrates acetylcholine. So will be useful in those conditions in which acetylcholine is deficient. And if you look at this particular list, you straightway eliminate schizophrenia and depression, anxiety, and we are left with Alzheimer dementia and myasthenia gravis, two conditions associated with some abnormality, so that the cholinergic effect is less, acetylcholine is less. Alzheimer dementia and myasthenia gravis. When you speak about myasthenia gravis, what are the drugs which come to your mind? To my mind, initially which comes is neostigmine, pyridostigmine, amenonium, demicarium, a short-acting agent, idrophonium. Donepezil is not coming on the list. Why? It's obviously not coming because donepezil crosses blood-brain barrier. It's got more cerebro-selective action against the cholinesterase enzyme, so it will be useful in the management of Alzheimer dementia. This is associated with deficiency of acetylcholine, and donepezil is one of the important agents used for Alzheimer dementia. Let's look at the answer. That's Alzheimer dementia. I hope you remember this. And I also told you the drugs used for myasthenia gravis. Question number 3. Drug acting on rate limiting step in cholesterol synthesis is cholesterol biosynthesis. What's the rate limiting step and which drug inhibits the rate limiting step? So we are in cholesterol, so we are probably speaking about the drugs used in hyperlipidemia. Let's have the options: nicotinic acid, simvastatin, cholestyramine, gemfibrozil and ezetimibe. You have these drugs on the list: nicotinic acid, simvastatin, cholestyramine, gemfibrozil and ezetimibe. And we are talking about cholesterol synthesis, and those who inhibit the cholesterol synthesis, those drugs are called statins. You remember atorvastatin, lovastatin, fluvastatin and rosuvastatin, and they are inhibiting the enzyme HMG-CoA reductase. And because they are inhibiting the enzyme HMG-CoA reductase, formation of mevalonic acid is inhibited. Finally, the cholesterol biosynthesis comes down. So, the formation of mevalonic acid from CoA, that's the rate limiting step. So, the drugs acting on the rate limiting step are statins, all the drugs ending with the suffix statin. And you have simvastatin on this list. Nicotinic acid is not concerned with the HMG-CoA reductase inhibition. Cholestyramine resin also not, it acts locally in the intestine. Gemfibrozil is also not, it's a fibrate. And ezetimibe decreases selectively the cholesterol absorption from the intestine. So we are left with the right option. Look at the answer, that's simvastatin. Next, which substance out of the following is obtained from bacteria? A. Tissue plasminogen activator. B. Urokinase. C. Streptokinase. D. Reteplase. And E. Tenecteplase. Tissue plasminogen activator is a thrombolytic agent used for dissolving the thrombus, dissolving the clot, and the substances are obtained from various sources. You have option B, urokinase, which is obtained from urine. Tissue plasminogen activator, if you try to remember its full name, it's RTPA. R is recombinant DNA technique. So nowadays we get the drugs by recombinant DNA technique. And the last two options, reteplase and tenecteplase, are the modified forms of tissue plasminogen activator, again obtained by recombinant DNA technology. So TPA is the action, tissue plasminogen activator is the same like reteplase and tenecteplase as far as the action is concerned, and they are all obtained by recombinant DNA technique. Urokinase is obtained from urine, and option C, streptokinase, that's why you have strepto in this name. Streptokinase is obtained from beta hemolytic streptococcus. So that's our answer, which is obtained from bacteria, that's streptokinase. Why this question is asked, there is something in my mind which we want to apply, is because it's obtained from bacteria, you have chances of hypersensitivity reactions with streptokinase, and you have less chances of hypersensitivity reactions with the other drugs. No problem about the recombinant DNA technique. They are least likely to produce hypersensitivity reactions, and also urokinase, that's coming from human urine, so you have less chances. So it's streptokinase. Let's go to the next question. Filgrastim is used in anemia, filariasis, malaria, neutropenia, and thrombocytopenia. There are two penias here. We need to pay attention to them. Anemia, we think of in anemia, iron, B12, folic acid, various other substances which can treat anemia. Filariasis is diethyl carbamazine and ivermectin. Malaria, many anti-malarial drugs, there is no filgrastim in this. We have neutropenia and thrombocytopenia. We are left with these two options. And when it comes to thrombocytopenia, you need specific substances which will be acting on the platelets. So this seems to be neutropenia. Let's search what's the answer. Yes, we are right, it's neutropenia. Filgrastim is nothing but granulocyte colony stimulating factor, that's GCSF. And this substance is useful in the management of neutropenia, especially when neutropenia happens in the immune compromised host, the patients with HIV disease, the patients on antiretroviral therapy, the patients who have cancer chemotherapy, all these patients who are likely to go for bone marrow suppression and neutropenia. Filgrastim, that's the granulocyte colony stimulating factor, GCSF, this can be used. So I hope you remember filgrastim. Let's go to the next question. Question number 6. Hofmann elimination is seen with vecuronium, pancuronium, atracurium, succinylcholine, and D-tuberculin. Option D is succinylcholine. Succinylcholine is a depolarizing agent, and vecuronium, pancuronium, atracurium, and D-tuberculin, all these are neuromuscular blocking agents. Sometimes I say such things to tell you that this drug is from this class and this class. It's just to make you visualize and make you revise your pharmacology. and this particular description may not be directly related to the question. So, succinylcholine is a persistent depolarizing agent which is short acting, rapidly acting, used for endotracheal intubation. Vecuronium, pancuronium, atracurium and D-tubercularium, all of them are competitively blocking agents, neuromuscular blocking agents. Out of this, Hofmann elimination, a very typical phenomenon, is seen with a substance called atracurium. What is Hofmann elimination? Hofmann elimination is spontaneous degradation of a drug without need of any enzyme. So there are two substances, atracurium and cis-atracurium. These substances undergo Hofmann elimination. This is an important information. You need to remember the two names, atracurium and cis-atracurium. That's your answer, atracurium. Next question. Question number 7. Which of the following is not used in acute asthma? A straight question. Think which drugs are not useful in acute asthma so that they are not going to produce bronchodilation immediately. Options: ipratropium, montelukast, salbutamol, hydrocortisone and epinephrine. Think of acute asthma. When it's acute asthma, what do we think of first? We think of a bronchodilator, and that bronchodilator could be salbutamol and terbutaline by the route of inhalation. They are going to work fine because they are selective beta-2 stimulants. So you try salbutamol first, see if you get a relief, and if there is no relief, then we need to think of something else. And for that something else must be some drug which is going to produce an acute effect, immediate effect. So for acute attack of bronchial asthma, you could think of epinephrine, which could be injected subcutaneously and sometimes by venous and intramuscular route of administration. If the acute attack of bronchial asthma does not respond to extensive bronchodilator therapy, you consider it status asthmaticus and you go for hydrocortisone hemisuccinate by intravenous route of administration. So we discussed salbutamol, hydrocortisone, epinephrine. Let's come to the first one, ipratropium, because it's easy. You can easily visualize what's ipratropium. Ipratropium is an atropine substitute. Atropine can dilate the bronchus, but it produces dryness of mouth. So atropine is not used in bronchial asthma. Ipratropium is an atropine substitute. Dryness will be less, and this drug is available by inhalation. Obviously, this drug can relieve the acute asthma because it will block the muscarinic receptor. So that's gone, ipratropium. We are left with a new agent, montelukast. Montelukast and zafirlukast are the leukotriene receptor antagonist. And montelukast and zafirlukast are available as tablets, and they will produce a slow action, and then they will not be useful to relieve the acute attack. They can be useful for maintenance. And there's a great value of montelukast and zafirlukast, especially in children whom we cannot teach how to inhale. You cannot rely upon the method of inhalation. It could be troublesome to the children. So as far as children are concerned, once again, montelukast has great value. So I think we came to the right answer. That's montelukast is not used in acute asthma. So that's your answer. So that was question number 7. Let's go for the next question. The next question is question number 8. Antimicrobial agent of choice in pregnancy is which one of the following? So you have a pregnant lady in front of you as your patient, and you want to prescribe an antimicrobial agent, and look at the names: doxycycline, clarithromycin, chloramphenicol, streptomycin and amikacin. I want you to rule out. I want you to finish 1, 1, 1, and then you will easily come to the answer, because I don't think this question is difficult. A is doxycycline. What is it? Tetracycline. Do we use tetracyclines in pregnancy? No. B is clarithromycin. That's a macrolide antibiotic. We don't know. Let's wait. Let's go to the next option. C, chloramphenicol. Do we use chloramphenicol in pregnancy? Obviously not. You know chloramphenicol is a toxic agent. And you know the grey baby syndrome which happens in the neonates. Obviously chloramphenicol is not going to be used, plus there is a risk of bone marrow suppression. Next is streptomycin. It is what? It is aminoglycoside. Is it safe in pregnancy? No. Aminoglycosides are not safe in pregnancy. And the last one, amikacin, is also an aminoglycoside. So it's also gone. So obviously we are left with clarithromycin. Please remember, as far as the pregnancy risk categories are concerned, clarithromycin is comparatively safer agent, and this can be used in pregnancy. So antimicrobial agent of choice in pregnancy out of these 5 is clarithromycin. So that's the answer, clarithromycin. Next question, question number 9. Which is effective in ulcerative colitis? 5-amino salicylic acid, 6-mercaptopurine, 5-flucytosine, 5 lipoxygenase inhibitors, and 5-alpha reductase inhibitors. The question is after the number, after the figure, and every option is starting with a number. 5-amino salicylic acid, 6-mercaptopurine, 5-flucytosine, 5 lipoxygenase inhibitors, and 5-alpha reductase inhibitor. After a long time, we came to a question from some different chapter, and that's ulcerative colitis. And the first option, A, 5-amino salicylic acid, 5-ASA or mesalamine, is extremely useful. It's a drug which is going to produce anti-inflammatory action not only in ulcerative colitis, it's also useful in Crohn's disease. So that's your answer, 5-amino salicylic acid. And you know it's a derivative of salicylic acid, so it's going to be useful. Now look at the other option. 6-mercaptopurine is an anti-cancer agent. It's a cytotoxic agent. 5-flucytosine is getting converted to 5-FU. 5-FU is an anti-cancer agent, and flucytosine is useful as an antifungal agent to be used along with amphotericin B. 5 lipoxygenase inhibitors. If you remember the previous questions, we just said a drug which inhibits the leukotriene receptor, we were saying montelukast, zafirlukast. One step before that, the drug which inhibits the leukotriene synthesis is the 5 lipoxygenase inhibitors, because 5-lipoxygenase is the enzyme which leads to formation of leukotrienes, and the drug which inhibits 5-lipoxygenase is xylitol, so it is useful in bronchial asthma. And the last option is 5-alpha reductase inhibitor. This 5-alpha reductase is an enzyme which inhibits the conversion of testosterone to dihydrotestosterone, so it's about prostate. The name of the 5-alpha reductase inhibitor is finasteride, and is useful in benign prostatic hyperplasia. So we could learn about many other drugs with this question. And finally, the drug effective in ulcerative colitis out of all this is 5-amino salicylic acid. So that was your question number 9. Let's go to the next question. That's your question 10. Transient deafness is caused by furosemide, ethacrynic acid, indapamide, amiloride, and isoniazid. Isoniazid is there on this list, but isoniazid is not supposed to affect the cochlear function. You have amiloride also on this list, which is a potassium sparing diuretic. It spares potassium, it doesn't produce deafness. Indapamide and furosemide are the two drugs. Loop and thiazide or thiazide-like diuretics, yes, they are known to produce the cochlear adverse effects, the hearing defects. And also ethacrynic acid. What is ethacrynic acid? Is from the same group of furosemide. So first 3, A, B, C, are likely to produce deafness. Furosemide, ethacrynic acid, and indapamide. Amongst these also, the loop diuretics are more prone to produce it. So let's remove indapamide from the list, and we have furosemide and ethacrynic acid, 2 left. Between the two drugs, if you remember, ethacrynic acid has got a very steep dose response curve. It has a very steep dose response curve. So a small amount of increases in the dose leads to very early toxicity, and its toxicity is the most ototoxic of all the diuretics, ethacrynic acid. So we are in favor of choosing ethacrynic acid. Transient deafness is caused by ethacrynic acid. Look at the answer. Yes, is the right answer. I think you enjoyed all the 10 questions, and you also learned. You can listen to the video, you can watch the video again and again. You revise your questions so that the important concepts are formulated in your mind and they get imprinted, and you make success on your venture. So my good wishes, best of luck, and thank you so much.